one of our patients who would like to share her story with you. Kim Waldrup. She's a lifelong resident of Houma who resides in Bourg with her husband of 41 years, Kenneth. She has 2 daughters.
Medical intervention as soon as possible. The problem is we simply don't equate our symptoms with a heart attack. Since for years, this just wasn't on our radar. We thought men owned the heart attack monopoly, but in recent years, we've learned differently. Aside from that fact, as Ms. Peoples brought out, as women in the family, we're the caregivers. We take care of everyone else before ourselves. But if we want to be around to care for those that we love, we have to rethink that concept. I had warning symptoms for 2 weeks before my heart attack. However, I didn't recognize them for what they were until after the fact. I'd like to tell you my story and my symptoms so that if you experience something similar, you can make the connection that I simply did not. There's just one thing that you need to remember though. Just as a man's heart attack is different from a woman's, even a woman's heart attack can differ from woman to woman. Unfortunately, there are no cookie cutter symptoms that we can rely on. My issues started with a pain in my left shoulder blade that would travel up into my neck and head. The pain was intense and it was a tightening, constricting type pain, which should have been a major key to me, but I didn't recognize it at the time. I also would have pain on my left arm at the top, and on the bottom, my arm would go numb. But 2 years earlier, I'd had shoulder surgery on the left side, and so I attributed the pain that I was feeling to this old injury. I also experienced a tightening sensation across from shoulder to shoulder, just below my neck, and this was in the front and in the back. But again, years back, I had been in a car accident, and I attributed that pain to that because I was no stranger to neck pain because of the accident that I had been in. My final symptom was jaw pain. I had jaw pain that went up along the left edge of my jaw, and at times I would even experience a pain in my left ear. Again, I had an excuse for that. I had been to the dentist earlier that week. I had dental work and I had to keep my jaw open for an extended period of time. So I blamed that as the reason for the jaw pain. All these pains varied in intensity and they came and went for 2 weeks. I really thought that these old injuries were the cause of my pain. And as you can see, it's very easy to take all these things that are happening to you and find a reasonable excuse or a reason for what's happening. I didn't for a moment think it was my heart because of the fact that the pains would come and go and they weren't constant. I had the misconception that when you were threatening a heart attack, the pain would just come on, it would be intense, it would get worse, and you would realize that something serious was going on. That's a misconception. The other reason I didn't think it was my heart was because I didn't experience chest pain or pressure. And isn't that the one symptom we all expect when we're having a heart attack? But in my case, it was completely absent. Those were my symptoms, but there are other symptoms that you shouldn't ignore as well, such as shortness of breath, nausea, vomiting, dizziness, profuse sweating, clammy feeling skin, an impending feeling of doom, headache and or blurry vision, heart palpitations, irregular heartbeat or a rapid heartbeat, chest or back pain that increases in intensity and isn't relieved by rest or nitroglycerin, and unexplained extreme fatigue. As you can see, as women, our symptoms vary widely, and that's why only you have the power to discern your symptoms and beat the #1 killer of women. Even if you're unsure, get it checked out. It's better to be wrong about your symptoms to be alive. My advice is, don't dismiss those early warning signs. They're trying to tell you something. And delay helps you to only have needless heart damage. I ask you, please, learn from my mistakes. You have the power to make a difference and take an active role in saving your heart. You know, we only get one heart. Sometimes we only have one chance to save it. My advice is don't blow that chance. Be a survivor. I'm glad that I am.